Hello, 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 you guys. Hello. Hold on. Let me start this the right way um, by doing my intro. Hey, you guys. This is your girl, Dr. T.O.D., Dr. Tamara Hill Bennett, optometrist. And I wanted to come on this morning to talk about, um, you know, winning tactics that you can use when you're having that patient doctor conversation, right? That conversation. And the reason why I wanted to talk about that today is because I've been on your side as a patient just recently. And I wanted to kind of talk about some of the ways that you can maneuver within that office setting so that you're not feeling like it's an overwhelming situation and just give you the back end based on the patient side and the doctor side because as an optometrist, in the eye care field, yes, I'm the doctor, but I too, in the regular world, I'm a patient as well. So I want to just take a quick moment to just kind of talk about some things that I think that will be helpful when you are seeing any doctor, whether that be your eye care professional like myself, an optometrist, or any other doctor, your primary care, a specialist, or anything like that. So, one of the things that I find helpful when on the doctor side is knowing the timing that it takes for the care. So, as you know, we are in this whole different season with, COVID-19, and things are done a little bit differently, like with telehealth, and maybe you have to do things on the computer first and before you come into the office. So, these are some of the things that are kind of like that time issue. So, if you know exactly what you're coming in for and knowing what the expectations of the time is, then that will help. Curb some of the expectations in the office. Okay. So, how do I get to talk about this? I've been optometrist for over 22 years, you guys. And so I can tell you about a lot of patient care dynamics. And so, one of the things that I know in my office that we pride ourselves on is having that conversation with the patient so that they are fully aware of number one, where I'm coming from as your eye care professional, but also what you need to do as a patient, right? This is your body, it's your health. And it is important for you to have a conversation with your doctor. So tip number 1 is the time. So if the eye care or your other doctors are asking you to fill out forms before you come in, please do that because that will definitely, number one, what that does is it allows the doctor to review anything before you come into the office. So, although you might have a specific reason for coming into the office, based on your questionnaire, that can also help with the end result, and that is your plan of care. So, if you answer those questions beforehand, I know it's like, why do I have to keep answering these questions over and over? It's because we don't see you every day. We're not having that conversation with you. We're not living with you. So we need to know these things before you come in. And that will help us guide how we take care of you when you come in or if you're doing telehealth, right? Um, so the other thing is with time, make sure that you understand your insurance. You know, don't be afraid to have a conversation with your insurance carrier to find out if particular procedures are covered. A lot of times, the onus is on the patient because that's the insurance company that you or your employer gave you or you chose to have. So a lot of times we don't know what's in the plan. Although we may look it up, we see it on the electronic portion as to, what the procedures are that are acceptable. But I have to let you know that insurance is not a guarantee of payment and it is not a guarantee of coverage. If you look on the back of your card, it will say that in some cards, right? It will say that. So, although we might even get a referral or an authorization for this, right? The time factor goes into everything that I just said. That front desk has to get an authorization. That front desk has to get that referral, especially with the primary care. If you're going to a specialist now, it's up to you to possibly some offices will ask you to get that information. For example, write this down. You would need the NPI, that's the National Physician Identifier. Each doctor has one. That is almost like our social security number that we use for everything. Okay, that's an MPI. And it's you can go to the website, you put it in, and you can find the MPI of your doctors. Okay. If you're having difficulty. Then the other time factor is knowing what code that procedure code that doctor is going to use. I'm going to tie this all up in a nutshell for you at the end. Then that diagnostic code, which is what we use, is called the ICD-10 code, your diagnosis, whether or not for me in eye care, myopia, hyperopia, presbyopia, conjunctivitis, diabetic retinopathy, hypertensive retinopathy, whatever, headache, whatever that is, you should know what that is. And sometimes you get that and you don't realize that you get it with your patient printout. You can always ask for a patient printout, and those diagnostic codes are there. Okay. So now let's move into some of the nuances of being in the office. Women versus men. Women have a tendency to talk a little bit more and ask more questions. Men, I need you to do the same just a little bit, to be okay with asking the questions because it's your body. And so that's why, if you look at things, most women are the ones in the household that schedule the appointments, right? They schedule the appointments. And so have your questions ready so that you can be sure. Put it in your phone. We have these devices. Put it in your phone. Put the questions in your phone of what this is, how do I go about asking that question? Okay. So that way you'll have it goes back to time. You will have a good time factor to really ask the questions. And so you don't have to go back. It's like, oh man, I forgot to ask that question, right? So write it down because it's important. When you have that moment to be in front of the doctor, there's a window of time that we have with you that you need to make sure that you capitalize on that time. Okay. Then the other part is really having a dialogue. It is, for me, I think it is important that conversation is a dialogue. It's not always the patient talking like you went to medical school and you know everything. No, that's not going to fare well. However, it should be a dialogue. Also, on the other end, for example, that doctor, if you're not understanding what that doctor is saying, tell the doctor, can you break it down in layman's term? I can't tell you within the last couple of weeks on me as a patient related to our family stepping in. When you're having a conversation, and maybe there's a doctor listening now, can you stop using a lot of the medical jargon and really breaking it down to the simplest forms? I think sometimes as practitioners, we're so into our own medical head that we forget who is in the chair that we're talking to. So it is important as a practitioner, to really make sure that that the patient is understanding. And listen, guys, as a patient, it is your right to ask us, I don't understand what you just said. And you need to make it clear as to why. And this leads me to why I'm saying this. It is a collaboration. Your plan is a collaboration of your care. And so if we're taking care of you, you also have to know what you have to do when you leave the office. So it is crucial that when that in that conversation and in that time, that you all are on the same page. The doctor is on the same page and the patient is on the same page. And so that's where that whole conversation, if you don't understand it, you need to let them know that you don't understand. Stop using big words and break it down. Stop using medical terms and break it down. Okay. And if that doctor doesn't know how to break it down, they may need to go to a course to do that. Sometimes we're not taught that. And so you need to break it down and don't be afraid. Hey, doc, can you please explain that so that I can understand it? It can be as simple as saying, you know, looking at this pen and looking at these glasses, they're kind of on the same color, but they're not. And so what we want you to understand is we want you to understand this is the color that we want this to be. Real simple. I don't know. I'm just saying, make it simple. Keep it to where that you can understand because it is your health. And then understand your role. You have a right to ask questions. If there is a practitioner that gets a little upset about you asking questions, maybe that's not the practitioner for you. Okay. And so if that practitioner just wants to shoo you out of the office, maybe that's not the practitioner for you. And I know I'll probably get flack from my colleagues, but maybe that's not the practitioner for you. Because at the end of the day, I want you to be happy with the diagnosis that I'm giving you or the care plan that I'm giving you, and that we are on the same page as what we need to do and in the interim and in that space before I see you again. So understand your role as a patient, okay? Understand your role as a patient when it comes to your insurance. Understand your insurance is the key if you're using insurance to covering about 99.9% of what goes on in doctors' offices. Knowing what your copay is, knowing if you need that referral, if you have an HMO, knowing whether or not you can actually see that doctor, although they're not in network. You can do that and understand those parameters. So it's important for you to have a dialogue with your care team. And this is why I say team all the time, because as an eye care provider, we are part of your whole team. A lot of times when you go to the eye doctor, we're diagnosing stuff that you don't really know that you have, because either one, you haven't seen a doctor in a while, or it's been a moment before like I said, it's been a moment between your visits. And so it's crucial for you to understand the importance of your role as a patient and the role as a doctor. The other conversation that I also had recently is making sure that you understand whether or not you're going to a private doctor versus an institution, because a lot of times that time factor will be a little longer if you are at a institution. Um, institution, private practice, and commercial. Okay, so some of the commercial places, to me, they're almost like factory made. So you're in and you're out. So if you going to those, of course, they have a lower for, at least for eye care, there might be a lower cost, that lower um, financial costs that's easy for you to adjust to, versus a private practice where the points may be a little higher. However, you're still getting the same care. Okay, but make sure you're getting that same care based on what I said before, is asking those questions. If that doctor does not want to hear anything that you have to say, that may not be the doctor that you need to go to. And if you're not a talkative person, then maybe you need to go to a doctor that tells you this, and this, and be done with it. Okay. And as long as you have the things that you need, that's what's important. So you as a patient have right to ask questions. You as a patient also has have a duty to follow the rules of that particular office, and it's a collaboration with your health. So this is your girl, Dr. TOD. Check out us at logiceyecareinc.org. You can also follow me on social media at 2020 eye doctor, where I'll be posting some of these things. And in the next half an hour, today, we will have patient conversation at 10 o'clock on Instagram. So I look forward to looking at your responses. And again, if you have any questions related to how you should continue that conversation, don't forget to post it in the chat so that we can go back and answer these questions. This is your girl, Dr. TOD with Logic IQ Incorporated. And it's always my pleasure to bring you tips that will help to what enlighten you, to help bring you to focus and enjoy your life, because life is about your vision, or vision is about your life. Be blessed.